Are you doing psychology? You are a psychologist. You are educating a person who is doing psychology. You are doing counseling. You have done counseling. You are educating someone who is doing counseling or any other course that is to do with psychotherapy or counseling services. Please have a place to sit and listen to this video. It's created for you. If you are in decision-making positions, you are in parliament, you are in health service commission, you are in public service commission, you are a commissioner, a minister, I call upon your attention. Please listen to this video to the end. I also call upon the President of the Republic of Uganda. Please give an ear to my advice or guidance. We have mental health issues that are on the rise in the country. We as the therapists, we are willing to give a service, but the platform and the structure has issues. I also call upon the education department, specifically the minister, the university stakeholders, the chancellors, the decision makers, the lecturers, the professors. I cannot approach you one by one, but I know this video will reach you. Please listen to it. Just a few minutes. It won't take the whole day. Kindly listen to it with interest, not with judgment. Once again, I am Kitemili. I'm a clinical psychologist by profession, and I'm a practitioner. The psychiatrists are doing their work. In as much as there are not many that are given the opportunity to serve, but there are also still very many on the streets, but they are doing their work. Those who have been given the job of supporting people with mental health issues through pharmacotherapy. The spiritualists, because these days we are using the biopsychosocial model, the religious leaders, the witch doctors, the traditionalists, all of them, they are also doing their work properly. I can't say they are not. But there is an area that is lacking, and that is psychotherapy. I know we have so many people who are presenting themselves as therapists or as counselors. Those who have done some short certificates in counseling, even if they are nurses, social workers, or what, they are presenting themselves as professional counselors. Those who are CDOs, development officers, and yes, we appreciate the work you are doing. But it is high time we brought the professional therapists on board. I appreciate the existing bodies that have done their best. SPA, Clinical Psychology Association for Uganda, and Uganda Counseling Association. I'll get back to that a few minutes later. But I appreciate the work that is going on. I want us to look at this right from community level to ministry. We have health centers, 3, 4, and then we have the regional hospitals and the national. My request is, let us have people who have done bachelors in psychology, one per each health center, 3. Then we have there one psychiatrist, and also we have one, not psychiatrist, PCO, yes, psychiatric clinical officer, and then also one psychiatric nurse. At Health Center 4, let us have one psychiatric clinical officer, one psychiatric nurse, and 2 psychologists with a bachelor's. One bachelor psychologist at Health Center 3, one bachelor psychologist, 2 bachelor psychologists at Health Center 4. And then at regional hospital, let us have one clinical psychologist or one psychologist at every ward or department. At maternity, we have one. At medical, we have one. At orthopedic, let us have one each at every department. Casualty, we have one. This will help a lot on mental health cases. I know that the counselors are listening in too. But what is psychology? What do psychologists do? They understand human beings' problems, and solve those problems basing on human being personalities, structures, interests, thinkings, and all that. And all that is bracketed as therapy or counseling. This brings me to the other concern and request. We have a lot of confusion when it comes to psychotherapy or counseling services. But this confusion is literally from the training, the university, the academic structure. People who are doing counseling courses, people who are doing psychology, people who are doing, when you talk to them, these people will tell you, we are almost giving the same service, which is counseling. So when a doctor treats, do we call them treaters? We call them doctors. I know we have so many countries that are offering all these branches of psychology, that even counseling itself is a branch in psychology. It is my humble request that we, as Ugandans, as Uganda, try to organize ourselves according to our own intelligence and needs. Yes, education was brought to us, but we cannot copy everything and paste it. Please let us call all the psychotherapists psychologists. Whether the person has done which, as long as they are giving a service that is of a professional therapist, we call them psychologists. And then we say we have psychology at bachelor's level and psychology at master's, where they specialize in whatever they want. At bachelor's, let's cover it all the way we do. I know this is already being done, but it is not specified that a person who has done bachelor's in psychology, bachelor's in counseling or what, is getting this. Let us align this with Health Service Commission and Public Service Commission. That when we ask for this job, we are not giving them two options: a counselor, a psychologist, a what. The difference here is just a few course units. Yes, even if it is true that the person who has covered psychology covers a few things that are a little more than a person who has done psychology, counseling. Let us incorporate whatever it is that is in counseling that is differentiating it from this person who is doing psychology. We merge them, and we have one psychotherapy course, and that is bachelor's in psychology. That way, it will be like the way you see we have a nurse, we have a clinical medical officer, and then we have a doctor. Because when it comes to a counselor, a psychologist, they are at the same level. So who responds to who answers who? They are doing the so-called different things, but when you find them giving a service, one is either copying the other or they are just almost doing the same thing. Isn't just duplicating of course units and courses and accumulating so many courses so that everyone feels relevant and present, yet it is actually causing a lot of confusion, a lot of conflicts, a lot of distress. Mental health issues actually amongst the people who have done psychology is very high, not because they don't know how to handle themselves, but because they are jobless. And their joblessness is because there are issues at management level. Let us iron out this so that we can give Public Service Commission one structure that offers psychotherapy, just as they are given one structure for nursing and one structure for medicine. Doctors and any other health service provider. And then when it comes to scale, we all know that whether you are doing counseling, you are still doing it in psychology because you understand a human being, you do assessment, you do diagnosis, you do treatment planning, which is therapy and standardized. You go through supervision, you go through training, skills development. So, the health scale be considered for people who are doing psychotherapy, specifically the Bachelor of Psychology. And then the other psychology branches can also be covered in arts. It's okay. The person who has done, the clinical psychology, health psychology, communication, community psychology, all those, let them be considered under clinical psychology. So that at university, we have a bachelor's of psychology. Then in your final year, you specialize in education psychology, clinical psychology, organizational psychology. You have your own area of expertise that you want your certificate to read, that you specialize in. And then when you go for your master's, you know where you are growing in. We don't want to have conflict, because there are so many conflicts when it comes to counseling and psychotherapy. And that is the reason we are not having these jobs. Because the counselors are saying we must get this scale because we are all offering the same service, we all follow almost the same process. The psychologists are saying for us we are different, we do this. But when you come to who created what, you realize it is still the same lecturers teaching psychology, and they are the same teaching counseling. They are the same lecturers who created these courses. So this is going to help us to have one academic language. Just as you see a nurse that is learning in Mbale is covering the same content that a nurse in Kampala is covering, that a nurse in Gulu is covering. So even when it comes to UNEB or exams, the final exams the nurses do, the same is with the doctors, the same is with the clinical officers, the same is with the lawyers. You cover the same thing. When we introduce one course for psychotherapy, that is bachelor's of psychology, and the end we have at the final year we have those specialties. And let us consider only the ones that can apply to Uganda right now, because major I see organization psychology can work, clinical psychology can work, education psychology can work if it is desired. Though a clinical psychologist can still cover education psychology work. It's just 1 or 2 course units. So if you are taken to a school, you know which kind of mental health support psychology you are giving to the students. And if you are the health facility, you know what service you are giving. Based on what you've diagnosed, the fact is you are a psychologist. So a psychologist will know which solution is for which problem. Just as we have always done. But the conflict is, who is who? We have UCA, Uganda Counseling Association. We have SPAO, Clinical Psychology Association. But there's one thing we are forgetting. There is a bachelor's of psychology. And that bachelor's of psychology is not well stipulated where it goes in line of service. Yes, they are saying they can get in gender, they can get where, they can get, but there is no parent who wishes to educate their children with a confused structure of a job. There are so many psychologists on the street who are crying themselves out in their bedrooms, in their houses. People are suffering, people are mentally sick because of job markets. Yet we have jobs that we are seeing with our own eyes, but we cannot access them because of the structure at the ministry level. I know that if you, Mr. President, just mentioned a word to all the universities to take this up and just make a decision of only educating people called psychologists. Yes, I know counselors came in when we had HIV, when we had, but at this time, HIV has been merged. I'm not saying it is inexistent, it's still there, but it has been merged into medical conditions and they are no more at clinics. So even these people who are done certificate in HIV guidance and counseling are now presenting themselves as professional mental health experts. But we know that is a lie. Yes, you can give a service and support, but we wish you to be aligned with a bachelor's in psychology. Those who are already there will recognize you. But at least let it be that from now on, let's have an organized psychotherapy platform. In that, if we are to have an session, let it be Uganda Psychology as session. And in that psychology session, we have departments for organizational psychology, for clinical psychology, and for any other psychology that the experts in academic areas deem or see relevant. But we can have them as departments under, just as we have the nursing body, just as we have other medical bodies or other serving bodies. And then when it comes to the structure of salaries or payment, we know clearly that yes, psychologist is studying a bachelor's of psychology. When they finish, they will get a job at a health facility such that that will become their office of giving a service to the community. I know this is very possible. And I know that if it is spoken right from our papa, our president, and then the heads of state, the ministers, the universities can do this. Because even themselves, they have also always have had issues. So some little dictation can work. When you just give an order and say, okay, let us have bachelors of psychology and then masters of psychology. People who are in health center 3s and health center 4s should be with bachelors, and the employees of regional hospitals should be masters. How many health centers do we have? Do you know how many jobs people with psychology will get at health center 3 and 4 in the whole country? People will not be lamenting. We will have solved the mental health issues that are with parents who have paid these students tuition, and we have also solved the mental health issues that are with people who have done psychology and are looking for ways of supporting, they're looking for ways of giving a service, but they're not able to give. The ones who are giving privately are charging highly, that it is hard for the community people to give or to pay to access this service. But this is because there is no way they can refuse to charge because they have paid fees. They have to take care of their problems. They have to dress up. They have to look good. They have to work. They have to pay places where they are working from, practicing from. But if the government can offer jobs, then this will work. I see counselors moving on wards with kids, testing people with HIV. I somehow get concerned. Since the art clinics have been merged, I request that all the lab tests be taken back to the laboratories, even for HIV. Because since we have chosen that we are not treating it as a special condition alone, but it is now like any other medical condition, then let it be tested at the laboratory. A person who has done HIV guidance and counseling, yeah, we know previously it was okay because we didn't have experts and so much, and HIV was still extremely so special. But right now, if it has been merged, then let the tests go back to the lab, and let a person who will be or who is structured as a therapist or a psychologist of the facility, even if it is that existing counselor at the moment, let them receive the results and they do the work of therapy, of counseling. Because I am no longer seeing the HIV guidance and counseling that I used to see before. So if a person is a psychologist, when I say psychologist, I mean when they have now merged and everything is moving the way it's supposed to move with a structure that is well laid, that aligns with a skill and an academic achievement of a professional. A person who will be handling a mental health patient Because whether the person has HIV or any other condition, they are still having mental health related issues. The reason you are doing counseling to them is because um, you're trying to support their psychological well-being in relation to the condition they are having. So if we have one course called psychology, it will make more sense and people will receive a good service. Just in addition, there will be so many benefits of this being called psychologist, the profession or the position being called psychologist, and the service being psychotherapy or counseling. This will make the Public Service Commission's work easy and simple and time saving, because then they will have a structured profession that they know they are supposed to give the work. The Health Service Commission will also have it uh, on their scale, and this will make it easy for them to also know that, okay, this is what a psychologist at bachelor's level is supposed to get on a scale, and this is what the one at master's is supposed to get on a scale. And these are the places where they are supposed to be employed, the health facilities. This will also quicken the work of the commission and the psychologist, because the psychologist will be very comfortable and secure knowing this is what I'm supposed to do and this is what I am doing, because we are trained, we know what we are supposed to do, but the insecurity can make people do shoddy things. When this is well stipulated, it will make life easy. This will also bring out the professionalism in psychotherapy that we are yearning for. We as therapists, we see a lot of things being done by the other colleagues of ours who are saying they are also counselors. When you ask them, are you a counselor? They say, oh, I am also a counselor. I am also a therapist. They cannot stand straight and say, I am a therapist. They say, I am also. You know what I'm talking about. And those are the people who are bringing issues. We are having therapy intolerance. I know some of you have not yet thought about this. But you see, just as patients can have resistance to pharmacomedicine, so do they have resistance to psychotherapy. And you know why this is happening? Because we have so many people who are presenting themselves as therapists, and what they are doing is not what is supposed to be done. But you see, when they give that Panadol of therapy, that paracetamol of therapy, and the person improves 1 or 2 days or just for a short while, so it keeps them going and they keep calling themselves therapists. But eventually, in a few 3 days, in a few months, in a shortest time possible, the relapses become relapses, and the people start looking at therapy as a treatment that does not work. Just because someone was tapping here and there, tapping here and there, and making it look like they're actually giving therapy. We now have so many professionals on the streets who want these jobs and who are willing to give the service. Let us wipe out the people who are presenting themselves as counselors as therapists. I'm not saying we condemn the other professionals from doing their work, but please do your work. If you are a social worker, do your work as a social worker. If you are a CDO, do your work as a CDO. It does not qualify you automatically to be a counselor or therapist. There is a process. Yes. So respect another person's role and job description just as they respect yours. For the sake of the patients, the clients, the community that is struggling with mental health issues, for the sake of the students who are doing bachelors of psychology or counseling, for the sake of the parents who are paying tuition painfully for their children to do these courses. Please let us put this into consideration and let us not just think about it and we sit with it. Let us make decisions and take a move that leads to results as soon as possible. The community is in need. The professionals are there. For those who are in management and you're making job creation for these positions look like it is your battlefield, I want you to think about the time when you had no job and you have a family, or you want to marry, or you have married, or you have siblings who are still looking up to you, or you have other people that are looking up to you. Is it necessary for you to continue holding on to positions, to jobs, to places, to pulling ropes instead of allowing the system to flow? We want to see psychology grow. So let us be the ambassadors. Let us grow in ourselves. Let us stop the conflicts, the confusion, and we make decisions that will work. Let us have one structure in academics that includes questions that are required, and let us have one job line of psychotherapy for easy service provision and monitoring, supervision, decision making. It is also for our own mental health, because as we grow old, we shall be answering to the new people, to the others who are coming up. I have students who are doing psychology that I sometimes render support in supervision, but there are questions. There are questions that cannot leave you the same. You might be comfortable because you have a job. You might be comfortable because you can afford a service when you need it or when your person needs it. But if you are sitting in a position that can make decisions, that can make psychologists or therapists be cleared in a structure as soon or as fast as possible, and they start getting jobs at health centers and facilities. Please think through and look into it. Thank you.